Hello, everyone, and welcome to one of our 11 Together to Goal Plank Mentor webcasts. Today, we'll be hearing from Dr. Carolyn Koenig of Mercy. Dr. Koenig is the Plank Mentor for the Adopt a Treatment Algorithm Campaign Plank. Dr. Koenig, thank you so much for joining us today.
You're welcome. I'm happy to be here.
Great. Could you please tell us a little bit about you and your organization?
Sure. I'm an internist by training, and I've been with Mercy Clinic here in St. Louis for the last 14 years. For the last several years, I've also been chair of our quality department and medical director of care management. Mercy Clinic is actually one of the largest Catholic healthcare organizations in the United States. The clinic as a whole crosses over 4 different states, but locally, most of our Together to Goal efforts have focused out of my area, St. Louis. And in that area, we have almost 1,100 physicians and almost 600 advanced practitioners. We're associated with 4 hospitals in the area. We actually own those hospitals, so that's a little different than some groups. And we have most specialties that you can imagine. Of those specialties, though, endocrine, of course, we have them, but we only have 5 integrated endocrinologists. So most of the work that we've done with Together to Goal has stemmed out of primary care. And, you know, I think that makes sense anyway, because we are often the first line of treatment for patients with type 2 diabetes.
Great. So tell us a little bit about your process for developing a treatment algorithm at Mercy.
Yeah, that process has certainly been a journey over the years. So we've been involved with Together to Goal, I think, since the beginning. And our first iteration of an algorithm was pretty homegrown and fairly simple. And that lived kind of in a document that you could access in Epic. We shared it at provider meetings and kind of emailed it around, but it just wasn't used very often. It was hard to get to. We had a second one where we started using more clinical pharmacists in the mix, and the same thing, we shared it, and it was better. It took into account more data on cost and efficacy. It was a little more digestible, but still, I just probably wasn't used a whole lot, given that it was hard to access. And so, you know, moving forward, where we are now is using not just the algorithm, but how do we get that into people's hands when they need it? How do we make it most usable? And going forward, we're looking at more point of care tools within our health records.
What considerations did you make in terms of what to include in the algorithm?
Sure. You know, we've always looked at the quality of the recommendations, and initially, the algorithms we even initially built years ago were a lot of physician input and based around ADA guidelines, of course. So we have physician-led quality committees that reviewed it, gave input, and that still is the case today. But I think recently, you know, over the last few years, there's just been exponential information to digest, and we're relying heavily on the ADA standards with the current recommendations. And of course, with those, there's so much information now to be learned about cardiovascular outcomes trials, side effects in terms of, you know, both beneficial side effects now, like weight loss, and you know, adverse side effects to take into mind. So we're taking those into consideration as we build our clinical decision support tools moving forward.
Great. So how do you plan to leverage this algorithm in everyday practice?
Yeah, that's always the question. How do we get it to the right place? How do we get people to actually use it? Even when we've been looking at the point of care tools where there's information embedded right at that moment in Epic in the orderable section. Our first iteration of using the algorithm really was too complicated. There were a lot of things that people had to decide. These are practicing physicians who've been dealing with diabetes for many years, but it asked them to go through decisions that, they already have in mind sometimes. They already know when to order the A1C, for instance. It was just too much to digest. So that one had information not just about diabetes medicines primarily, but statins, lab orders, educational videos, et cetera. So going forward, I think that the point of care tool that we're currently working on is mainly just focusing on the diabetes medicines in and of themselves. So the current tool is both intuitive and informative, and also actionable at the moment. So it will suggest certain medicines, and not suggest others based on the problem list and that sort of thing.
Wonderful. So our last question for you here today is, what recommendations do you have for groups seeking to adopt their own treatment algorithm?
Sure. I think, the benefit of this collaborative is we can all figure this out together, but just at very high level, I think you want to know your audience. So, our group, like probably everyone else's, has a wide range of people who are taking care of patients with diabetes. We've got new physicians who just came out of residency who, have heard all the information about the cardiovascular outcomes trials and all the novel insulins. And you have physicians who are kind of, nearing retirement, who, when they first were trained, practiced diabetes very differently. The diabetes care at that time was very different. We also have nurse practitioners and other advanced practitioners who are front lines of diabetes care, clinical pharmacists too. And so having, the right information for the right person at the right time is really important. And you have to make it so that it's actionable and very helpful. We really want these algorithms to be useful and easy to do, so we can really focus on patient care.
Great. Well, we just want to say thank you so much, Dr. Koenig, for all this wonderful information today. We appreciate you taking the time to share your insights and experience with this campaign plank. As a reminder to fellow participants, if you'd like to contact Dr. Koenig to discuss implementation of the Adopt a Treatment Algorithm plank at your organization, please email t2gmentor@amga.org. Check out our remaining Together to Goal Plank Mentor webcasts on our website to discover what other experts have done to improve diabetes care across the country.